Hi friends, I am SHUBHAM VISHNU from NCRD'S Institute of Pharmacy.
Topic of my video is Antimicrobial Resistance, my understanding. In this video, you are going to know about definition of antimicrobial resistance, explanation of antimicrobial resistance, and precautions to avoid antimicrobial resistance. So, what is antimicrobial resistance? Antimicrobial resistance occurs when microorganisms such as bacteria, viruses, fungi, and parasites do not respond to antibiotic drugs due to the evolution in them to survive against antibiotic drugs that creates resistance in microbes. Confused? Okay, let me explain. When we take antibiotic in illness, it kills bacteria in our body, but not all, some remains. That remaining one learns how to survive against antibiotic drugs, make changes in itself, and carry forward genetic information so next generation can contain antimicrobial resistance and antibiotic cannot hurt them. Hence, due to the changes, bacteria become more powerful, so no any antibiotic could harm them, even they can fight against them. So, whenever we introduce new antibiotic drug, bacteria will create AMR definitely. It is quite simple as theory of natural selection. It explains how genetic information of disease changes over time. This allows mutation in microbes. As human has adapted changes according to the environment to survive, every living thing, no matter size, tries to survive and adapt changes according to the environment and pass on to the next generation and become more compatible to live against any environmental condition. In case of microbes, our body acts as their environment and antibiotic changes this environment. Then, when we take antibiotic at first time, they adapt changes in environment and create antimicrobial resistance so they can survive against these changes. Now, when we take antibiotic for second time, they have already become more powerful and they do not respond to antibiotic drugs. It's so dangerous for us. Antibiotic making us weak every time when we take it. Let us see one case study. A 49-year-old patient showed symptoms of fever, weight loss, and expectoration on being diagnosed with tuberculosis. She was prescribed rifampicin, pyrazinamide, ethambutol, and isoniazid. The patient also showed symptoms of hemoptysis. She had to undergo branchial artery embolization for hemoptysis. The sputum culture showed positive result even after 18 months of combined therapy. The drug susceptible test was performed at Hinduja Hospital, Mahim, where the mycobacteria were found to be resistant to rifampicin and isoniazid. The physician then changed the drug regimen to cycloserine, PAS granules, and afloxacin. Also, streptomycin was administered parentally for 3 months every alternate day. The streptomycin affected 8 granule nerve, which is turn affected the body balance. The medical history of patient including 15 years of diabetes. She had suffered from tuberculosis 8 years back and had stopped taking medicines on her own as the sputum tested showed negative result for tuberculosis. The antibiotic resistance MDR-TB developed due to non-compliance of patient to take drugs for the desired regimen of 6 months. Here are some ways to tackle antimicrobial resistance. 1. Global public awareness campaign to aware public about antimicrobial resistance. 2. Improve sanitization and prevent the spread of infection with help of government and NGOs. 3. Reduce unnecessary use of antimicrobials in agriculture and dissemination into the environment. 4. Improve global surveillance of drug resistance and microbial consumption. 5th. Better incentive to promote investment for new drugs and improve existing one. Now, what pharmacists should do about antimicrobial resistance? 1. Do not compromise in prescription. Provide antibiotic as per prescription by physician and recommend to do not take less or more dose than prescribed one. 2. Avoid antibiotic as OTC drug. Do not prefer to dispense antibiotics over the counter. 3. Use knowledge about antimicrobial resistance. Tell the patient to ask physician to do not give antibiotics until and unless it's so necessary. Here are some references I go through to make this video. I especially want to thank teachers from NCRD'S Institute of Pharmacy and more especially Professor Anshuma Patel Gupta ma'am for her guidance. The whole part of case study was given by her and that was the best part of this video. I hope you understand what is antimicrobial resistance through my video, and thanks you all for watching my video. Have a nice day. Also guys, like and share this video to spread awareness about antimicrobial resistance.